Hello, everyone. Welcome to Buddha Zen Wisdom, where we accompany you every day. Just one surgery, and a person's health can take a steep dive. Doctors are saying that there are 5 diseases where surgery is unnecessary. Don't let ignorance harm you. Let me tell you about Mr. William, a man who just celebrated his 70th birthday. Up until then, he had always been in great shape, but recently, he was diagnosed with a benign tumor in his intestine. The doctors advised surgery to remove it. This is typically a small and routine procedure, so the family was hopeful. They believed that after the surgery, Mr. William would continue to live a healthy and active life. The surgery went smoothly, but unexpectedly. This marked the beginning of a rapid decline in Mr. William's health. At first, everyone thought his weakness was just a normal post-surgery reaction, but as the days passed, Mr. William did not recover. Instead, his condition got worse. He lost his appetite, couldn't eat much, and his sleep deteriorated. Any noise would wake him up, and even light physical activity left him out of breath. His weight dropped, and his energy levels were nowhere near where they used to be. This type of decline after surgery is actually not all that rare. Why do surgeries sometimes cause older people to deteriorate in health? In the vast field of medicine, surgery is a double-edged sword. While many patients emerge from the operating room with improved health, there are also those who experience a rapid decline in their condition afterward. It's essential for us to understand why this happens. Furthermore, some conditions do not require surgery at all. In fact, overtreatment can lead to harmful consequences. Let's take a deeper look at what surgery is all about and explore the risks involved. 5 common surgical risks you should be aware of. Surgery is undeniably an essential part of modern medicine, saving countless lives and effectively addressing complicated health issues. However, it is far from risk-free. Before deciding on surgery, patients and their families should understand these potential dangers. Surgery, after all, is a traumatic intervention in the body, like making repairs to a finely tuned machine. Even though the aim is to fix one problem, there can be unintended consequences on the surrounding areas. Let's explore the risks involved in surgery. 1. Tissue and organ damage. When a surgeon makes an incision to remove a problematic area, it's similar to editing a painting. The goal is to eliminate the flaws, but it inevitably impacts the surrounding areas. During surgery, tissues such as the skin, muscle, blood vessels, nerves, and bones are cut and potentially damaged. Take a common surgery like a leg fracture repair, for example. The surgeon has to cut through the skin and separate the muscles to expose the fractured bone. This process not only leaves a wound on the skin, but also disrupts the muscle structure. Blood vessels might be squeezed or severed, and nerves could be stretched or injured. Moreover, if the surgery involves a nearby organ or area, such as in the case of lung cancer surgery, there's a risk of damaging neighboring organs like the heart or large blood vessels. This could result in serious consequences. 2. Anesthesia risks. Anesthesia is an essential part of surgery, working like a magical tool to keep patients pain-free. However, like any magic, it doesn't always work perfectly. Most surgeries require anesthesia, either general or local, but anesthesia carries its own set of risks. Some patients may experience respiratory depression, where their breathing becomes shallow or irregular, affecting the delivery of oxygen to the body. Allergic reactions are another risk. Patients may suddenly develop rashes, itching, or even trouble breathing, which can lead to anaphylactic shock. Heart arrhythmias are also a possibility. Anesthesia can sometimes interfere with the heart's electrical system, causing irregular heartbeats, which is especially risky for patients with existing heart conditions. Additionally, the success of anesthesia greatly depends on the skill of the anesthesiologist. Much like a bartender mixing drinks, an anesthesiologist must adjust the dosage based on various factors such as age, weight, and the type of surgery. If the balance is off, the patient may experience pain during the procedure or suffer from complications, such as delayed recovery or cognitive dysfunction. 3. Bleeding risks. Bleeding during surgery is a serious concern, almost like a storm that could erupt at any moment. If the body's clotting mechanisms fail or if blood vessels aren't properly sealed, it can lead to excessive bleeding. Minor bleeding can cause anemia, making the patient feel weak, dizzy, and pale. Chronic blood loss can also result in low blood pressure, affecting the heart and brain. Severe bleeding can be life-threatening. If a large amount of blood is lost, the organs may become deprived of oxygen, leading to shock. If bleeding isn't controlled in time, the patient's life could be at risk. 4. Infection risks. Surgery carries an inherent risk of infection. During the procedure, the body is like a fortress with its defenses down, leaving it vulnerable to bacteria and viruses that could cause infection. This is particularly dangerous in surgeries like gastrointestinal procedures, where improper sterilization of equipment or a breach in sterile technique can lead to infections, such as peritonitis. After surgery, patients are often in a weakened state with reduced immunity, which makes them susceptible to lung infections or wound infections. Lung infections can cause symptoms such as coughing, sputum production, fever, and in severe cases, difficulty breathing. Wound infections can slow down the healing process or even cause the wound to reopen, requiring additional treatments. 5. Post-surgery complications. After surgery, patients might face several complications that impede their recovery. These are considered the side effects of surgery and can hinder the healing process. One common complication is lung infections, particularly in chest or abdominal surgeries. After surgery, patients may find it difficult to cough up mucus, leading to bacterial growth in the lungs. Intestinal obstruction is another common issue. Scar tissue from the surgery may cause parts of the intestines to stick together, making it hard for food to pass through properly. This can cause symptoms like abdominal pain, bloating, vomiting, and constipation. Kidney damage is also a concern. The combined effects of blood loss, low blood pressure, and anesthesia can affect kidney function, making it harder for the kidneys to process waste and regulate fluids. 5 diseases that don't require surgery. Avoid overtreatment. In the modern age, we often see surgery as a quick fix for all sorts of ailments, but it's crucial to realize that not every condition needs an immediate surgical intervention. Overtreatment can sometimes do more harm than good, leading to unnecessary pain, expense, and risk. Here are 5 diseases where surgery is often unnecessary. 1. Herniated discs, lumbar disc herniation. A herniated disc in the spine is a common issue, like a ticking time bomb, causing discomfort and limiting mobility. However, most patients, around 90%, can find relief with conservative treatments. Only a small percentage needs surgery, typically for severe cases. If you have mild symptoms, rest, physical therapy, and medication might suffice. 2. Lung nodules. Lung nodules are becoming more commonly detected with advances in medical technology. While some nodules can be cancerous, the majority are benign. Doctors typically monitor these nodules with regular imaging tests to track their size and any changes. Surgery is only considered if the nodule shows signs of malignancy. 3. Thyroid nodules. Similar to lung nodules, thyroid nodules are often benign and don't require immediate removal. More than 90% of thyroid nodules are harmless. Surgery should be avoided unless the nodule is large, causing symptoms, or suspected to be cancerous. It's important to remember that not all medical conditions require surgery. By understanding the potential risks and recognizing when surgery is truly necessary, we can make better informed decisions for our health. Always consult with your healthcare provider and explore all treatment options before opting for surgery.